Let's study cardiac cycle, which is an important topic for both medical and dental students. A cardiac cycle is the sequence of mechanical and electrical events that occur with every heartbeat. The human heart is a muscular organ located slightly left of the center in your chest, protected by the rib cage. It's about the size of your fist and works as a powerful, double-sided pump. The human heart is made up of 4 chambers, 2 in the upper part of the heart, and 2 in the lower part. The 2 upper chambers are called the atria. The right atrium is located on the upper right side. The left atrium is on the upper left side. The 2 lower chambers are called the ventricles. The right ventricle is on the lower right side. The left ventricle is on the lower left side. Let's follow the path of blood as it moves through the 4 chambers of the heart. It all starts in the right atrium, which receives deoxygenated blood from the body through the superior and inferior vena cava. This blood then flows down into the right ventricle. The right ventricle pumps it to the lungs through the pulmonary artery, where it picks up oxygen. Now, oxygen-rich blood comes back from the lungs into the left atrium, through the pulmonary veins. From the left atrium, it flows down into the left ventricle. The left ventricle, the strongest chamber, then pumps the oxygenated blood to the entire body through the aorta. Events in cardiac cycle. Atrial contraction phase. Let's look at what happens during atrial systole, the first part of the cardiac cycle. Atrial systole means the atria, the 2 upper chambers of the heart, contract. This happens right after the SA node, the heart's natural pacemaker, sends an electrical signal. It's a quick phase, lasting only about 0.1 seconds. When the atria contract, the pressure inside them goes up. This helps push extra blood into the ventricles, the lower chambers of the heart. About 30% more blood is added. We call this the atrial kick. It helps fill the ventricles completely before they pump. At the same time, the openings of the veins bringing blood into the atria, like the superior vena cava, inferior vena cava, and pulmonary veins, narrow. This helps prevent blood from flowing backward into the veins, even though there are no valves there. As a result, the venous return, the amount of blood coming back into the heart, slows down for a moment. B. Ventricular systole. Isovolumetric ventricular contraction, duration is 0.05 seconds. Ventricular systole proper duration is 0.25 seconds. Let's talk about isovolumetric ventricular contraction first. It lasts only about 0.05 seconds, and begins just after the atria have finished contracting. Now, the ventricles start to contract, and pressure inside them rises. As the ventricular pressure goes above atrial pressure, the AV valves, that's the mitral and tricuspid valves, close. This closure produces the first heart sound, also known as S1. At this point, all 4 valves are closed, so the ventricles become a completely closed chamber. Even though the muscle is contracting, no blood is leaving yet, which is why we call this the isovolumetric phase. The volume stays the same. The strong contraction also causes a slight bulging of the AV valves into the atria, leading to a small increase in atrial pressure. Now that the ventricles are fully contracted and pressure is high, we enter the next stage, ventricular systole proper. This phase lasts about 0.25 seconds, and it's the part where blood is ejected from the heart. First comes the rapid ejection phase, lasting just 0.1 seconds. The pressure in the ventricles exceeds the pressure in the aorta and pulmonary artery, causing the semilunar valves to open. Blood rushes out quickly, and most of the blood, around 2/3 of the stroke volume, is pushed into the arteries. As blood enters the arteries, pressure in the aorta and pulmonary artery rises, and the AV valves slightly shift back, causing a temporary drop in atrial pressure. Next is the slow ejection phase, lasting 0.15 seconds. Now, the contraction slows down, and the ventricular pressure starts to fall. However, blood still flows forward for a short time due to the momentum already built up. This brings the systolic phase to an end. The total amount of blood pushed out per beat is called the stroke volume, around 70 to 80 milliliters. That's about 65% of the blood that was inside the ventricle before contraction. The blood that remains is known as the end systolic volume. Let's talk about the ventricular diastole, which lasts about half a second. It has 4 phases. First, protodiastole, the ventricles relax, pressure drops, and semilunar valves shut, producing the second heart sound. Second, we have isovolumetric relaxation. The heart relaxes more, but no blood enters yet, as all valves are closed. Then comes the ventricular diastole proper, where 70% of the blood flows passively into the ventricles. This happens in 2 steps, first rapid filling, then slow filling called diastasis. Finally, in the last rapid filling phase, the atria contract to push in the final volume of blood. Now, let's move to atrial diastole, which lasts longer at 0.7 seconds. During this time, the atria relax, and pressure slowly builds up due to continuous blood return. When pressure is low enough, the AV valves open, letting blood flow into the ventricles passively. As we near the end, pressure rises again in the atria, preparing for the next contraction. If you like the video, don't forget to like, share and subscribe to Biology Bliss. And turn on the bell icon for more such videos.